Gather supplies like non-sterile gloves or clean gloves, alcohol swab, lancet, 2x2 gauze or cotton ball, reagent strips, and blood glucose meter. Determine if the blood glucose meter needs to be calibrated according to agency policy to ensure accuracy of readings. Read and understood the manufacturer's instructions and agency policy for the blood glucose meters. Review the patient's medical history and current medications. Determine if the test requires special timing, for example, before or after meals. Perform hand hygiene. Check the room for transmission-based precautions. Then introduce yourself, your role, the purpose of your visit, and an estimate of the time it will take. Confirm patient ID using two patient identifiers such as name and date of birth. Then explain to the patient the process and ask if they have any questions. Then be organized and systematic. Use appropriate listening and questioning skills. Listen and attend to the patient's cues. Ensure the patient's privacy and dignity. And lastly, assess ABCs, which is airway, breathing, and circulation. Have the patient wash their hands with soap and warm water and position the patient comfortably in a semi-upright position in a bed or upright in a chair. Then encourage the patient to keep their hands warm. Well, washing reduces transmission of microorganisms and increases blood flow to the puncture site. Then apply non-sterile gloves or the clean gloves. And the next is keep the area to be punctured in a dependent position. Dependent position will increase blood flow to the area, and do not milk or massage the finger because it may introduce excess tissue fluid and hemolyze the specimen. Then remove a reagent strip from the container and reseal the container cap to keep the strips free from damage from environmental factors. Do not touch the test pad portion of the reagent strip. Follow the manufacturer's instructions to prepare the meter for measurement. Place the unused reagent strip in the glucometer or on a clean, dry surface such as paper towel with a test pad facing up based on manufacturer's recommendations. Then select the appropriate puncture site. Cleanse the site with an alcohol swab for 30 seconds and allow it to dry. Perform the skin puncture with the lancet using a quick, deliberate motion against the patient's skin. The patient may have a preference for the site used. For example, the patient may prepare not to use a specific finger for the skin puncture. Then transfer the second drop of blood to the reagent strip per manufacturer's instructions. The test pad must absorb the droplet of blood for accurate results. Read the results in the unit display. Apply pressure or ask the patient to apply pressure to the puncture site using a 2x2 gauze pad or clean cotton ball or tissue to stop the bleeding at the site. Read the results in the unit display. Turn off the meter and dispose of the test strip, 2x2 gauze, and lancet according to agency policy. Then remove gloves, perform hand hygiene. Then lastly is document the results and related assessment findings. Report critical values according to agency policy, such as values below 70 or greater than 300, and any associated symptoms.